since you guys were on time, we don't want to take advantage of, you guys being responsible for being here at 2 o'clock. So we are going to have the panel go ahead and introduce themselves, give a little background of your education, all that stuff, and then we'll kind of have a similar flow as we did this morning. So we're gonna switch it up and start with.
I was looking, I was like, stop me. My name is Kenny Sykes. I'm currently a second year pharmacy student at University of Tennessee. I graduated in 2009 from the University of Virginia, majoring in biological chemistry. Along with doing the pharmacy degree, I'm doing the business degree as well.
My name is Kashay Sanders. I'm currently a fourth year dental student at Meharry Medical College. I went to Tuskegee University for undergrad, graduated in 2012 with a bachelor's in chemistry. And I am doing my residency in oral maxillofacial surgery at the University of Texas, Houston, which is a 6-year program. I'll get a dual degree in.
Hi, I'm Sparkle Williams. I'm a postdoctoral research fellow at the University of Alabama in Birmingham, Alabama, where I'm originally from. I did a Bachelor's of Science in Biology at Tuskegee University, and I came here at TSU to do the Master's and PhD program in Biological Sciences as well.
Christina Howard, got my bachelor's from Langston University in Oklahoma, then came here to TSU, got the master's and PhD. I'm currently a postdoc fellow at University of Kansas Medical Center in Kansas City.
Hello, my name is Sharika Brown. I am currently a PhD student here at Tennessee State University. I also received my master's here as well, and I have a bachelor's from Jackson State University in biology.
Good afternoon, my name is Paul Marte. From Mount Juliet, Tennessee originally. I got my bachelor's at the University of Tennessee in Knoxville in biochemistry and molecular biology. I did my master's here in biochemistry, graduated in 2014. I'm currently a first-year medical student at the University of Tennessee Health Science Center.
Okay, so like I always do, I'm gonna start this off. That was one of my first questions.
I'm sorry, can you introduce yourself to the rest?
Oh, yes, I keep forgetting. Okay, I forgot. Dr. Tyler, and I'm here at Tennessee State University. My background is in engineering, and I went to North Carolina A&T, Aggie Pride, and received my PhD at Miami, Ohio. So, so let me just start the discussion off talking about. Well, let's start. I think one good place to start is a question we had sort of at the end this morning was that motivational piece. Let's start there, and I think everything else can rebound off of that. But if we could talk about the one thing that motivates you and encourages you to continue on the path that you are.
I have a 5-year-old daughter, so that's my motivation. Actually just came from seeing her prior to having this talk with you all. I don't know if you have kids, so I may not be able to relate to you, but my child by far motivates me to persevere and overcome any obstacle.
The thing that motivates me, I guess, is finding my passion and just living up to my greatest potential, knowing what you're capable of and knowing that you are capable of doing it and accomplishing it, and just always having that at the forefront. Also having a good group of supportive friends, colleagues that encourage you along the way and push you along the way is very motivational as well.
I feel my family motivates me. They've always pushed me to go ahead and achieve my goals, keep me motivated, just give me that encouragement that I need when I'm having a bad day. Also peers, when you go out and you see your peers and people that you aspire to be like, so that motivates me. Like, hey, I want to do what you're doing. So,
My motivation is basically being a step above my family, to where I'm not complacent in standing in the same place, doing the same thing. I want to be able to live life. So that's what's motivating me, continuing to do my education and to like that.
So I'm the youngest of 4 siblings. My older siblings, they're all in their 40s. I'm in my 30s, but I find that they come to me for advice. So that speaks volumes to me, and that, okay, they see what I'm doing, they respect that, and so they're going to come to me when they need, motivation or advice on something else. And also, in my immediate family, the highest degree obtained is an associate's degree. And so I would have the highest degree amongst my immediate family, so that's kind of what motivates me.
What motivates me, I would say, is always trying to become the best physician I can possibly be. I mean, everyone said my family member to a doctor who doesn't know what they're doing, so I use that as kind of a motivation to say that, pushing up, waking up, studying, continuously doing this day in, day out, it's a sacrifice I have to make sure that I'm always the best for whoever comes to see me. In addition to that, it's kind of like a competitive thing for me in a way, because while I'm relaxing or not studying, somebody else is getting ahead, somebody else is doing more. And it's kind of like my competitive nature, and I kind of channel that. So I would just encourage you, whatever mechanism you have, always, turn it into something that you can use to motivate you to always keep going to what you want to do.
I was trying to find my notes from this, but I can't find them. So, and I failed to do this again in the beginning, so you all know who's in the audience and their background. I think it'll help you articulate what you say. Can you all introduce yourselves and say where you are in your programs, and then what you are aspiring to do? Then it would help them as they have a dialogue with you in terms of, assisting or whatever.
Well, the first one, what do you mean, as far as what you're trying to do?
Like for
Immediate
instance,
future or long term?
you can do both, doesn't matter. I mean, it's an open dialogue. So I just think it better helps them. They know, you're in this field and you're trying to go this way. So they can offer you advice. Because one of the other questions we're going to talk about is some pitfalls and some things that they did that could help, along the way, and, stuff like that. So.
All right, well, my name is Kevin Terrell. I am computer information system engineering student. I'm in the dissertation phase of my PhD. I got my bachelor's in electrical and computer engineering, and my master's was in system engineering. I currently work for the Boeing company, and that's where I should want to go to afterwards, because I haven't met a company that had as far as engineering, benefits package that matched them. But long term, I also want to, for my, like you're saying, deal with family, I want to be able to have for my family, when I have children and everything, to have businesses to be able to pass on to them. So my ideal goal is to have 2 businesses of my own. So my next focus, I've already taken business management minor in undergrad, but I want to get an MBA in the future. That'll be my final career, so that I have another little piece for it, and working with other people when it comes to business-wise, that I can communicate with them, let them know I've done my research on this side, not just the engineering side, so it won't be frightened off of my business abilities as well.
My name is Sylvester Boyd. I'm a second-year physical therapy student here at TSU. I got my bachelor's in exercise science and wellness from UT Martin. That's where I'm originally from. I don't know if any of y'all know about the small town of Martin. But I came here, like I said, for my doctorate in physical therapy. I'm still trying to get my feet wet as far as clinicals go. I did my first clinical at Metro General, just down the street in an outpatient facility. I got to see a little bit of intensive care as well. So I'm honestly open as far as what particular area of physical therapy I'd like to go into. I originally started in the program because I played basketball in high school and kind of wanted to stick around sports, which everybody kind of has that whole reason to getting into the field. 33 out of 35 people in my class played sports and came for that reason. So I know that that's kind of a very difficult part of the field to get your feet into at the door as far as that goes. But I've kind of exposed myself to geriatrics as well. I'm kind of like that population as well. So at this point, I've got a clinical at a skilled nursing facility this upcoming summer in Dixon, Tennessee. And we've got 2 more clinicals after that, so I'm just trying to decide which particular area of physical therapy best suits me. Home health, anything, the money, because is also a factor as well, so.
We're gonna have a long discussion about that in a minute.
Exactly, that's part of the motivation in a sense, I don't know if that's the right thing to say.
No.
But like I said, I do enjoy it, and I look forward to hearing what you all have to say, y'all skills as well.
I can speak of the motivation for you.
Yeah, you can, yes.
People find it funny when I say mine. Mine originally is two parts. First is I wanted to get to the level of highest degree because the only person in my family, immediate or any extended, is one PhD was my uncle who is a professor, a retired professor from Brown State University of Physics. He's the one that got me into the STEM things, and then from that point I went on. The other reason has been the one that I always kind of make a joke. I can say it in this room, it doesn't sound as bad. I've always wanted to make anybody who wants to disrespect me because of my race or white person or anything to have to call me doctor if you want to refer to me.
That's what's up.
I'm saying that's the reason why I had it for my money and all that, but if you're going to disrespect me, you're going to at least call me doctor when you try to disrespect me.
I can feel that. Another, I guess it's more on the motivation thing. I can kind of relate to you as far as family goes. I'm the youngest of 3 siblings, and some of them have gotten their masters, but none of them have gotten their doctorate. And like I said, Martin is kind of a small, predominantly rural, white town. So just coming up in advanced placement classes and just being that one of 2 black people in your class, and just kind of having to play that role for the longest, just kind of made me want to do better for myself and to, like I said, further what my parents did for me to allow me to be in that position. So then I came to TSU, kind of expecting to be around more of us. I can say that since we're all there in the room. And actually, in the 33 people that I have in my class now, only 5 of us are African American, even here at TSU for the doctoral program. So it just seems like the further and further you go into education, at least in my experience, the least I see of people that, look like us. So just from that, I kind of find motivation internally and externally as well, because, there's no reason that I should be at an HBCU and still feel like a minority in my own classroom. So I find that as motivation to hopefully, use what's been given to me as far as these opportunities to show someone else that, like, hey, I did it, you can do it too. It's just a matter of having that desire and going out and looking for the resources instead of just thinking that that's not there for you. So.
Hello. You all introduce yourself. Just tell us what your program is, where you are, and maybe what you intend to do the next step. That way the panel can, have a quick dialogue. They know who you are.
They know me, but
What are you?
We're in the same lab.
yeah.
Oh,
I'm
you
a
teach
teacher. I was with my advisor, so I actually have to leave in a little bit, but I wanted
That's okay.
to show my face.
Oh, okay.
But I'm Shanique Lawrence. I'm a PhD candidate in Dr. Williams' lab. I'm not on
Title III.
Title III, right? So maybe that's not even.
Okay.
But yes, so I work with Dr. Williams,
Okay.
and the question was what?
Well, so we know you're in a doctoral program, right?
Uh-huh.
And so what are you trying to go to, like, medical
So
school,
after,
dental school?
right, so afterwards, like, I'm gonna defend in June,
Oh, okay.
hopefully, and I wanna go on and do a postdoc. I'm actually looking into a postdoc right now. I have an interview soon in infectious diseases, so immunology/infectious diseases, and then I wanna go on to medical school and hope to become an oncologist.
Okay.
And as far as my motivation, yes, as far as my motivation for that, I'm from Jamaica, and it's a third world country, as you know, and I've seen family members and friends, suffer from cancer, not be able to afford treatment, and just other diseases, so I'd like to contribute to the field and hopefully to my country eventually. And yeah, I'd like to just make an impact in that area of cancer research, because there are no, how there are many facilities here, research groups, so on. There's not any in my country, so I'd like to impact that. So.
Okay. Well, since you, and you have no problem saying you came in a little late, let me just real quickly, so you know, because people up here now, I think would be beneficial to you. So we have a pharmacist in pharmacy school, followed by someone who's in dental school, on their way to a practicum in
Oral surgery.
Oral surgery. It don't take me to repeat nothing. Okay, and of course, 2 postdocs. And then we have Paul in the medical school. Okay, so the last 4,
I know the last 4.
Okay, good.
Well, I must apologize because I'm actually missing on a meeting. I told her I'd be right.
No, you're
So
fine.
I'll slip out soon, but I just wanted to
No problem.
come in and ask my questions.
Okay,
maybe
well, here we go.
before
We can segue into asking your question.
Okay, so my question is for Sparkle and Christy, and eventually I have a question for Paul, but for now. As far as postdoc interviews, how was it? Like, what type of questions were you asked, and how did you feel just, in the interview?
Well, I went through the whole interview process, so I just felt like I was back at just step 1. It's like all the things that they tell you what to do and what not to do for an interview. But it's weird going for a postdoc interview because you'll go in, especially if it's out of town. So they're gonna bring you in for, say it's a Thursday interview. They'll bring you in the day before that Wednesday, usually take you out to dinner. So all the things that you're taught, like, oh, don't have a drink, and I'm like, no, I'm okay. And they're like, no, everyone's getting wine tonight. And these are researchers and everything, and it's the same thing with conferences. So I'm like, okay, if you're gonna force me to get wine, but I'm like, is this a trick? Am I gonna be like, haha, you got wine on your interview and not, they consider me or whatever. So the next day, usually they'll take you around to the campus. You usually give a talk about your, current research, your dissertation. Most people are defending at that time. They'll ask you, of course, if you have questions, definitely ask questions. That's one thing they always tell you to do. It could be just something, how many postdocs do you have here? Or what will be my responsibility? So definitely ask something. They will ask you questions. Of course, ask about funding. Don't be afraid to ask, like, hey, if you offer me this position, how long do I have? And what's my salary? Vacation time, benefits, all of that. Definitely ask all of that because they won't necessarily tell you up front, okay, well, some people will. They may say that you have a year or 2. So you don't want to get in a situation where you have 6 months or a year and you don't even know about it. But like we said this morning, apply early. One thing that I did not do that I wish I did was a spreadsheet of everywhere that I applied to or wherever. I would write it down, but it got stressful because it's like, okay, did I email this person back? Did I follow up and say thank you? Did they email me back and reject me, or did they accept me and say come back? So keep up with everybody that you applied for. And I would say, at least 5 to 10, I think is good, but depending on how it goes. But when you get into the 20s, 30s, it's hard to keep up with all of those. So narrow it down to where you want to be. And for me, I did not know I was going to move back to Alabama. So you know that whole story, personal story. But keep an open mind as to where, you're going to be at your job majority of the time, 40 hours plus, so you know how research goes. So you want it to be an environment that you're comfortable with. The city, that's second choice to me. A lot of people, find the city first for various reasons. So for you, it could be, okay, well, I want to go back home, or I want to stay here for various reasons, but make sure it's somewhere that you're going to like, because you're going to be there all day, every day, late hours, weekends, that you want to be there.
How about if you heard before people in the lab and they tell you not the greatest things about the lab as far as the person, but it's like, I wouldn't let someone's personal experience say, let me not apply.
Right.
But at the same time, it's like you're cautious because if something happens, you're gonna be like, I was
Definitely
told
listen
this.
to that. Yep. If they, a lot of the PIs, they will say, okay, well, I'm gonna leave you in here with everyone else so you can ask all of those questions. So I would just say, because I feel like that was slightly a trick, because you have some people that will probably go back to PI, whatever, but ask just, make it politically correct as to what questions you ask. Oh, okay, so how's your lab environment here? What is the work environment like? Things like that, and most people will be honest with you, but it could just be a bad personal experience that they had. So, but if your gut will tell you. If you're getting a good vibe from it, 9 out of 10 times is probably a good place.
And one more question, either you can answer. As far as your current research, what if that lab doesn't, it's in the general area, how do you justify your research and wanting it to their lab?
I feel like with mine, I'm kind of just everywhere. Yeah, like various projects, and to me, they're all still linking together. So I've just been able to like connect the dots with it. So most PIs will let you kind of, if you can justify it in any small portion, then they'll say, okay, well, have at it, like, you know, you can go for it.
I think we're kind of both, you know, she came from physiology, I was in neuroscience, she's neuroscience, now I'm in kidneys.
Oh.
So we both kind of switched to that. The thing I've learned that now I'm applying for jobs, is that I'm taking the proteins that I work with, because that's across the system, and I'm just applying it to a new system, you know, because a cell is a cell, you know. I'm just applying it to a new system, so it's not as hard of a transition, when you talk about different organs.
I'm doing some of the same things, still doing cell culture. I'm doing zebrafish model now, so it's basically still just cells, even though they're embryos. But some of the same things, Western blot and RT-PCR, all those things, you know, you can just kind of get another model and do the same thing.
How about, did you find that there was publication requirement as far as they expected coming in, you had at least a certain number? Did you
They
find
didn't have an expected number, but within that first year is that transition year. So now we're really like, okay, well, let's get this out. So, I mean, I'm trying to get several out within this year. So they just want to see that productivity. So the thing that, versus with me, with being in a program, I'm more stable. So I don't have that where I have to like fight for funding or whatever. I'm stable in my salary now. So I don't have to like look for something within a few months. But that's, you know, depends. So definitely ask that, how long do I have?
Well, I don't know if you know or not, but my postdoc, I didn't have to apply, because it was the same person I worked at Vandy with.
Okay, yeah.
And so she just moved labs, so I'm basically moving with her. But coming in, we didn't discuss publications. Once I got there, it was like, okay, she's in her mid-career trying to do all this stuff, get grants and trying to get funding, which needs publications. So we got 4 postdocs in the lab. Everybody is trying to get a publication. So it's not like you have to get 2 or 3, it's just how many can you publish, you know. So it's not a set number. It's just whenever you got the data, let's put it in the paper, let's go.
How about from your PhD going in? Did they expect from
She didn't expect me to have any, just because she knew me already. But what I've been hearing is that it depends on what your skill set is. So if you're at a high institute, research institute, they want at least 2 or 3. But if you're not, it doesn't matter.
Tell me about your
Am I applying? I didn't apply.
Oh, okay. But the process, so you only went to that one, you didn't see
Yeah,
that?
so, no,
Okay.
When she left, I was in my 3rd year PhD when she left. And we had talked about it, and the reason why I stayed with her during my PhD, I talked to my committee about this too, is that the stipulation of me coming back while I'm still in school and taking away from my research is that I got 2 publications automatically, just being a part-time person. And so I got the 2 publications from that. And so with that understanding, she's like, I don't want you to be stressed. She said she felt like she owed it to me to help me transition out of the school, which is why she's offering me the postdoc. So I said, okay, I'll take it, you know. So I didn't even think about applying it anywhere else because I just knew I was going. But then you were here when I had that month transition of I didn't have the funding, I didn't have the job. So at that time, I was just applying anywhere I could just because I needed a job. She eventually got the money, you know, so then I eventually went. But during that time, it was really stressful trying to find someone just to interview. I had one interview, totally different system. I was Scorpions. I was like, what? But the fact is I still transitioned my skill set, you know, doing Westerns, doing, you know, things like that. You know, I still basically pub that and say, I can still do this work even though this is not my organ or this is not my model that I usually work with. So, I mean, as long as you play up your skills, it should be fine.
Paul, so one question for you. I know you finished master's. How was that transition going into medical school?
It wasn't as seamless as I would like it to be. Ideally, you want to just finish and then have some wrong and start medical school. But I actually worked for a year at toxicology lab. So I was doing a lot of forensic mass spectrometry. So I did that, to pay the bills for that year. But as far as getting my degree, I guess I always be specialized when we get more training, like, and give you more opportunity to go get these other kind of jobs. Because when I had my bachelor's and I was applying for jobs, like, they might call you back, but most of the time you don't get a call back, or you end up working some job that's not even in your field. So after I got my master's, I definitely got a lot more attention, from employers, and it gave me an opportunity to work in a lab, make a little bit of money before I actually started medical school the following year.
How was your transition into medical school?
Uh,
Application?
I said this in the last session. It's kind of like you never know what to expect. It's really like somebody just taking you and throwing you deep into the pool. The only things like during the interview process and for like a lot of other schools is that they want to see whether or not if they throw you in the deep end, you know how to swim. Because like they're not necessarily teaching you how to swim. You need to teach yourself how to swim. What do you need to fix? Are you a problem solver? So the transition really, there's no uniform transition into medical, at least from my perspective, there's no uniform transition into medical school. I'm pretty sure they'll say the same thing for other professional schools too. It's like you're just being tossed in the deep end, but you have to learn how to swim.
Did you find that your master's was of benefit?
Yeah, no. I mean, I don't like research, so that's, but it was something that actually caused me to, or made me actually pay attention to details, like made me more meticulous than I was initially. So I appreciate gaining that, but in addition to that, I gained more from the tutoring aspect, teaching other people, like the students that we have. Like, I gained so much from that because, like, it helped me solidify the material, but also it helped me, like, just teaching it over and over again. And then, like, as I go through and I'm just thinking about things, like, I can understand, things so much better. And I really appreciate that aspect of it. And just being exposed to different things, like some of the classes that, like immunology is a clutch class for me because, like, had I not taken it here, I'd have to be learning immunology for the first time, in medical school. And I don't like learning things for the first time in medical school. Like, I don't like it at all. So it's I was telling the other class, like, it's very wise to try and take as many of these classes that you'll see in professional school while you're here, because when you get there, it's just like a refresher. So
I want to ask a question in there too, based on one of the people from this morning. Because it was always been my misnomer or my thinking that, because here at TSU you can do a thesis and non-thesis. Can you go to these professional schools and get on a non-thesis track? Could someone be on a non-thesis track and go to medical school or dental school or pharmacy?
okay, so I mean, I guess no, not really. You can go to medical school and like if you don't want to do a residency, you can do like a 1-year internship, become a general practitioner.
Okay.
General practitioner, but you're not necessarily specialized, but you're just like you're pretty much like the primary like go-to doctor. Like a lot of the military positions will be general practitioners.
Okay.
They'll be on the the Navy, like a lot of the guys on the vessels and the doctors that they have on those ships, like they'll be general practitioners. And pretty much they can diagnose like common illnesses and things of that nature, but you're not specialized in a particular field. That's not too common. It's more common for people to specialize. But it's not necessarily like thesis and non-thesis. I think that's more specific to
Yeah, I chose thesis route.
Right, majority of you all did, right? You or your undergrad was in chemistry? Right.
And I went to dental school straight out of undergrad.
Oh, okay, so you didn't take the master route? Oh, actually, that's a discussion right there, okay. Okay. And how about you? You went from undergrad straight into pharmacy? Wow.
Okay, we've had some friends though who've done the non-thesis route and then tried to April did, went pharmacy school because she just wanted to have that time to prepare for pharmacy.
For people who are not wanting to do research, they usually choose that.
Yeah, if it's just a transition period, they don't know what they want to do.
Right.
They do non-thesis.
But do they have a more difficult time getting into these professional schools? No, not these.
Most of them you don't have to have.
Oh, okay. Okay.
Yeah, most people go on. So a lot of us, when we're thinking me, I didn't know I was gonna do PhD. I thought I was gonna do master's and do medical school afterwards.
Okay.
So a lot of people go straight into it. So it just depends on if you're definitely gonna do that, because I felt like, okay, and I could also, teach here and also taught adjunct at a couple community colleges as well. So that was like, an extra kind of hustle on the side. But I felt like I had that. If something just happened that was not gonna turn out for PhD, then I had my bachelor's and master's to kind of, until I got that together. So, I mean, just things could happen. So,
Okay. Well, trying to parlay a little bit off of these two gentlemen, I know that background specifically. We had one was like you, Chris. He knows where he's going. He's interned with them, and hopefully won't be any surprises when he graduates that he has a job. And then we had, I don't know if too many of you all have the DPT background, but here at TSU, it is a practicum, even though it's a professional degree, it is a practicum degree. And so what that really means is the scientific stuff that we talk about and the biology and stuff like that, they go through it, but not as much. So, and you correct me as I want to make sure that you are, so they understand. So they do the lockstep 2 years, right? Lockstep 2 years, lockstep classes 2 years, and then they go on a 3-year practicum that's tied to a course. And then help me out, then when you all graduate from that, you come back to take a test, right? Which we'll talk about.
Oh, yeah, the NPT is what we take.
At
That's
the
just
end of
for
the third
National
year.
Physical Therapy examination. That's all across the nation that we take that. So there's no particular exam that we have to take as far as in the third year. Once we're back, and we graduate in May.
But when do you take that test though?
We can take that beforehand, so we're licensed, or we can graduate and take that
Afterwards.
after graduation.
Oh, okay.
So that's the way it works, and our clinicals are somewhat mixed into the didactic portion of class as well. So like I said, I did my first clinical at Metro General, and as far as clinicals go, we're just required to do them in one of 3 different settings, so acute care, outpatient, and then like a skilled nursing facility. So we get 4 clinical opportunities. And so that 4th one is pretty much just we get to pick which field it is or which area of physical therapy it is that we like to pursue. And that's our 10-week one that we do before we come back and graduate in spring.
That third year.
Correct.
That third year. Okay.
Correct. And as far as the scientific part of physical therapy, we were exposed to physiology and, their general anatomy and physiology. We did our anatomy in the cadaver lab at Meharry. We were in there with the med students. So it's one of those things where we're more geared toward the orthopedic side of things and the neurological side of things. We're throughout the course, physiology and anatomy, that's kind of like your foundation in order to understand biomechanics and the movement of the body. And then from biomechanics, you learn therapeutic exercise. And then you kind of just go into just general orthopedics, which is where we are now in year 2. So it's kind of just like a structure of, learning the basic neuroanatomy, and then in the event that you do want to be a neurological PT, you have that background as well. So from a physical therapy standpoint, pretty much what we concentrate on is the neurological and orthopedic side of things versus going into every particular organ. We just delve we just really scratched the surface with that material. Like we had a couple of differential diagnosis classes. So in the event that we see things that we do need to refer someone to a physician for, we're capable of kind of like seeing those signs and symptoms and seeing that that's something that's outside of our scope of practice. So that's pretty much the direction that physical therapy is. So.
Okay. All right. So one of the things we talked about earlier in the earlier session was, which you sort of touched base on it. And actually, I don't think I've said anything about engineering, so I'll let you talk about this part, was testing. We talked about, once you go into these fields, what tests are required in order to enter into the field. And quite frankly, again, I said this morning, that's one of the reasons why I chose engineering. Even though I had my EIT, I took the EIT, I did not take the PE, but practicing engineer is what the PE stands for. but that was okay. It's not a required license like you're required, and Paul's required. They're required, you're required. You know, we're not required to take that PE. I mean, normally you only get the PE if you are wanting to put your names on drawings, you know. So if you're going into like anything dealing with the architectural realm of design, and your name has to go on design, then that's when you really need that PE. Unless you just want to go get it for personal edification. And I didn't need that. So, you know, I didn't take that. So, you know, even though it's not really applicable, just for the sake of the conversation, can we have that discussion again? So just for knowledge for them, you know, because who knows where, you know, and I know you talked about business a little bit, and so, you know, he's getting his MBA. So let's just start there. Let's just talk about the back end of your matriculation of where you are.
In order to gain interest into pharmacy school, you will take what's called the PCAT. Pharmacy school is 4 years, 2 years of didactic work, and the last 2 years you do rotation. Upon graduation, you will take 2 licensure exams. One is law-based focus, depending on what state you want to practice in. Then you have a more generalized test called the NAPLEX that every pharmacist takes across the country. Now, for the MBA part, fortunately, we have an agreement with the University of Memphis that since we're pharmacy students, we don't have to take the GMAT. That's the entrance exam you have to take to, you know, to matriculate into an MBA program, usually 2 years. And based on your background, there are several programs out there. I know the University of Memphis has one that has the standard MBA, but they also have like a concentration. They have a business information technology concentration. You can look into that. Most of your MBA programs can be completed 100% online, which is convenient. So we just start researching, seeing what schools require, where some schools don't require a GRE or a GMAT. Some schools don't even require an application fee. So it's just about where you want to go. Just start emailing the program directors to see what kind of concentrations they may have or maybe bring in the future.
With dental school, we take the DAT, similar to the MCAT, just has perceptual ability, but basically basic science courses. So you do 4 years of dental school. After the second year of dental school, we take our first board exam, and then after the third year, we take our second board exam. So once you do those, you're technically board certified as a dentist. To be licensed as a dentist, you have to do a clinical exam following your 4th year, and then you also do a computer-based exam as well. And then once you're licensed, depending on what state you want to go to, you may have to take an additional test for the more popular states. But following licensure, you can really go out and practice if that is what you would like to do, or you can go into a residency program.
So technically,
Yeah. Technically.
Well, you all the standard GRE
Yeah,
and
standard,
PhD.
yeah.
Let's go down the hall.
So for entrance into medical school, you have to take the MCAT. It's an examination very similar to the DAT. Many components to it: physical science, biological science, and the verbal section. You have subject matters from chemistry, biology, physics, verbal, organic chemistry. I think, and there's a reading comprehension component to it as well. But basically, this is just a standard test that you need to get into medical school. In addition to that, some of the other requirements are clinical experience, shadowing doctors, just anything in a hospital setting that gives you more exposure to how healthcare is actually practiced in the United States. So that's extremely beneficial. You know, that sometimes that can even outweigh some of the other things or mitigate some of the other things that are lacking in your application. But aside from that, yeah, the interview process is, yeah, a lot of people kind of like think that interview process is should be a very tense situation. But a lot of times, the best thing to do wherever you go when you guys are in school, but it's very laid back. You know, like a lot of times you want to relax, you want to be like very like straightforward and just like personable with the person. You know, you don't want to be too, you know, like seem like you're a robot. And I think that's a mistake that I made before, and I think that people in the future but all those things, are things that you're required, that are things that are required to actually get into medical school. I think it's a skill that they're always looking for.
But you want the test to come out, don't you?
I'm sorry, I didn't mean on that yet.
Oh, let her,
Yeah, so there's a test to come out too, so there's a, it's a step one. So step one we take after our second year. It's pretty much the most important test that we'll take in medical school. It pretty much determines what kind of residency you'll be competitive for, and just a lot of things. So, you know, like a lot of med students, you'll see the first 2 years where we're taking our basic sciences. We're always studying all the time, study, because we're really worried about that step one, because you want to be, you know, family medicine all the way to neurosurgeon. It depends on how you get on that test. But after you take that test and you get the score you need, we go into our clinical rotations, which is pretty much we just rotate between the different specialities in the hospital. So you do a family medicine rotation, you'll do internal medicine, you'll do OBGYN stuff, you'll do pretty much all the basic ones, and then you'll do a few electives. And after that, you'll take the test called the step 2. I believe that's the 4th year, like somewhere like the last semester of 4th year. I'm only really focused on step 2, right? I'm step 1 right now, so I don't really know exactly when I'm supposed to take that test. But there's these board tests that we call the steps, step 1, step 1, step 2 that we have to take to transition to the next level. But yeah, if you don't pass those tests, you know, like you have to retake the, you know, maybe I think you have to retake like a whole year or something like that, or something of that nature. So it's really imperative that you do well on that test to continue on with your career in education.
Do you have any questions?
No, none in particular.
Okay.
They covered everything. Trying to think of something.
I know that, and that's why I was trying to, because unlike this morning or the norm, you know, you already have a job, so it's not like you don't need to ask questions, because I guess you get, even though you've been born 3 summers, 4 summers, okay. So the likelihood of you getting in there and saying you don't like it is probably small, but that may not be your only stop. I mean, that may be something you start there and then later on venture off to either another career or enhance your career. You know, so I know it's kind of difficult because most of the people we have here on the panelists are in the scientific field. You're in more of a practical field. But I was just hoping that some of the things they say, or if nothing else, just for the knowledge that that, you know, because we talked about this in the last session. You know, sometimes it's all about reaching back. And so even though these may not be paths in which you all may take, it's good knowledge for you to help someone else along the way. You see what I'm saying?
And a lot of the things that they're saying, like I said, definitely hold true even to the field of physical therapy. Even, you know, just for future reference, like I said, with the interview process, getting into physical therapy school, there goes a classmate. Like I said, with the interview process of getting into physical therapy school, it was quite similar as far as trying to be as personal as possible. And even something that we just recently learned as far as being the ability to reach your patients. Like the most important thing was being personable and being relatable. Like if your patient doesn't like you, the chances are they're not going to be as compliant. So, you know, you can have all the knowledge in the world, but if you can't convey that message in a kind manner, or a sociable manner, then it's kind of like not going to reach them at all. They're not going to be as apt to, you know, do whatever it is that you need them to do outside of the treatment that you give them face to face. So, like I said, everything that you all have said still holds true to physical therapy, even though it's not really that much of a science.
That is one of the things they add to the MCAT. I've been talking to some people. That social skills, they have a psychology part to it now.
Exactly. We've kind of been doing a bit of research on emotional intelligence. That's the new big thing that everybody is focusing on as far as being able to kind of be empathetic and put yourself into the shoes of your patient or whatever it is that you're dealing with. And like I said, just kind of being able to kind of put the shoe on the other foot. So, yeah. Courtney, want to introduce yourself to these good people?
Hey, my name is Courtney Peterson. I'm also a second year DPT student. I'm not sure what all Sylvester has said, but since I walked in, everything is true what he said. No problem. But yeah.
Where you from? Where you got your undergrad from?
Oh, okay, yeah. I went to Auburn University. I got my undergrad in microbiology. I'm from a small town called Thomaston, Alabama. Population there is like 500. Went to a little small 1A school, and here I am. So what are we actually talking about?
I love him.
I was gonna respond to what you said.
Okay.
The other difference for me is like, well, one thing about me, I'm always a person that takes every field or every discipline that I work with and meet with and learn something from for other people and not only for myself. So anything that I listen to might not necessarily be directly applicable, but it can be applied to just understanding the thought process of how I go about things. That's just what I do with everything that I do with anything. But also, even with Boeing, even though I work for Boeing, I work at 4 different sites.
Okay.
Well, actually, technically 4 different sites, but 2 in the same city, because you have St. Charles and St. Louis, but they're both in Missouri, but they're like right near each other. But there was 4 different sites, 4 different managers. All the managers basically are, it's pretty much 4 different jobs basically. So what I learned is I can, the personable and the when things be spoken of on being personable has applied to them there. Every manager except for, actually, she loves me too. Yeah, every manager has always spoken to me and said that they see me as being a quality benefit to the company, just from my short experience. I literally, most of the time, has been because they give a task, they expect me being a grad student, of course, I'm expected to do a little bit more than a normal intern would when they come for just a few summers for it. Mine is really like a full-time employment for just a short summer session. But they give me real work, like they give me a project I got to complete. They expect it to be done by from May until August. I'm typically done by July, about pretty much my birthday, which is early July. I just tend to, so I won't be looking like I'm doing nothing the rest of the time. I try to let it hang on. As soon as they ask me if I need it,